Hey, it's Dr. Tiffany. I'm here today to talk a little bit about low thyroid. Low thyroid is one of those topics that a lot of people don't know that they have the problem. They don't even realize that it could be related to a lot of the symptoms that they might have or be experiencing. And it's quite common, actually. 1 out of 5 women and 1 out of 10 men have a thyroid problem. That's about 30 million women and 15 million men. And actually, unfortunately, about half of them are not even diagnosed. And they don't even know that they have a thyroid problem. So that's just way too many people out there suffering needlessly with symptoms that they can be addressed. And we all know the symptoms too. They're common symptoms. They're nothing crazy. It's feeling tired, constipated, having hair loss, low libido, memory problems, depression, being cold all the time. They're very common symptoms. And that's one of the problems too, is that the symptoms can be vague or they can be subtle and they go undiagnosed, or they're blamed on other problems when in reality they all could just be, one common underlying cause, which is low thyroid. So low thyroid affects the quality of life, and it really does get worse if it's not properly addressed. So there's too many people suffering from it. It's not being diagnosed or treated properly, and a lot of that comes down to your doctor not really running the right tests. Most of the time, they're going to run a TSH, which is a thyroid stimulating hormone. Maybe if you're lucky, they're going to run a T4. But really, there's about 10 other markers that need to be checked for anyone that's suspected that there's a thyroid problem. So if those are not being run, then the real problem is easily missed. And I think that's what's happening in a lot of people, is that they're just not getting diagnosed properly. But the good news is that when you do figure out the underlying root causes of your problem, then they can be addressed naturally and effectively. And that's really when we start to see that the problems, the symptoms go away. People start to feel better. They start to feel like themselves again, first time in years sometimes. So if you or anyone you know suspects that you have a thyroid issue, I really urge you to address it now before it starts to control your life. And that's just coming from hearing so many patients tell me that they wish they would have just listened to their body a little bit sooner and got the help sooner, because there's no need to just keep wondering if you have a problem, and there's really no need to be suffering from it. So there's absolutely a better way to address low thyroid.